Next, I'd like to turn to Fabiola, is it Pavel, who's a janitor in Clark County. Fabiola, are you here?
I'm here.
Pavel, I apologize. I didn't even come close, but I'm half the time to multi, so I understand the issue.
That's all right. My name is Fabiola Pavel, and I'm an SEIU member, and I work for Clark County as a janitor. I'm also a primary caregiver for my 78-year-old mother. My mother has Medicare, and the problem lies in that the providers will not use diagnostic tests and treatments that will diagnose her sooner and treat the problem faster. Question is, sir, what is your plan for providing preventative and diagnostic services and health care for our seniors, people with disabilities, and all Americans?
One of the facets of the plan would be to keep in place Medicare and Medicaid and phase them out over time. Because plans to put everybody on Medicare aren't going to fly financially and just can't be met. And so they can tell you they can, but it can't be met. We are in deep economic difficulty and in debt. And so when you talk about the seniors, this is where you have these health regional boards where in that region, they will be defining what goes into the various vouchers. And they'll change every year, depending upon your personal history as you get older. And we know it costs less for young people, and it costs more for old people. That's just the nature of the situation. So I don't have any magic to take care of the seniors. All I can say is I can set up a structure that will have checks and balances where they'll have a better say than they have today. 77 million people are going to be retiring in the next 25 years. Those are the baby boomers. That's twice the amount of people, the senior people that exist today. If there's a group that's going to benefit from the National Ballot Initiative, it's going to be the seniors, because they'll have more clout to be able to vote for programs that they feel will address their particular needs. That's the answer that I would offer to you, not a magic wand from Mike Gravel as president. It's from the people being involved directly with the power to make laws on policy issues that affect their lives. That doesn't exist today, and there's nobody running for president, Democrat or Republican, that's even suggested that. Oh, they talk about big changes. They're cosmetic changes, and they're Band-Aids to the problem we face in this country.
Well, could I ask a follow-up that I think gets to the premise of Fabiola's question, if I understand it correctly, which is that, and have you found this in your own experience as a patient and also as a policymaker, that elderly patients in particular, that the medical system doesn't seem to have the same aggressiveness and the same sort of curiosity? Is that sort of what you were getting at here in terms of diagnostic testing and the kind of treatment that elderly patients receive?
Maybe I didn't answer her precisely. Doctors do a lot of testing today to cover their backside, because they don't want to be sued. Now, one of the features of these regional boards is we're going to do away with what we see that the attorneys love, and that is to go sue doctors or raise the costs where they can't even stay in business. And the same thing with nurses. That's got to go. Now, you want to see how much money the trial lawyers are pouring into the presidential campaigns? Just as a couple of young people out there doing their blogging and putting that data out. Look at that data. That answers the whole question. So we can't have everything. You cannot have everything. And so you're going to have a basic plan that will cover, and the way the plan is designed, it won't raise cost. Because the 30% that they're talking about, which is the paper cost, if you took that and put it into some real cost in healthcare, you can cover everybody without raising any cost. But you do have to recognize that you can't have everything you want. You can't have a burp and run to the doctor. We've got to be responsible as citizens, and that goes back to this whole preventive medicine, where we change the culture. That itself will lower the cost. But also, until we are totally in a new culture in that regard, we have to have some discipline on what the basic package will be. And that is a decision. And you want to raise the basic package, and your lawmakers, we'll put an initiative up, and let's say we're going to raise the cost rather than 7% for the basic package, we're going to raise it to 10%. Let the people decide. That's the slogan of my campaign. Let the people decide. Why should the politicians be also omniscient in this area, and they know it all, when they can't even produce a decent plan? I hope that addresses the follow-on question.
Thank you. We have about 1 minute left, and so I wanted to ask you your slogan, let the people decide. What's your plan from here on out? You come into this race without a lot of name recognition, without a lot of money, without a big organization. Where do you go from here?
Well, the problem of not a lot of money can be solved by the people who hear my voice. And it's not going to be the lobbyist bundling money for me. It's not going to be the corporations that are going to be giving, through their executives, giving me any money. It's going to be if my voice can be heard. And I don't need the $50 billion, $100 billion, or $1 million that they're going to spend. All I need is a modicum of money, around $10 million, and I'll win. I'll win, because I'll be able to get to the American people and say, the solution is with you. It's not with the leaders. And if I become president, and lightning will have to strike for that to happen, but you know something? You know something? Lightning has struck all the time in presidential elections, all the time. Anything is possible in politics, and I could be your next president. I could be your next president. And if you're worried about my age, don't. We can get a young man as vice president.
Right.
Okay? And there's a few around.
Well, thank you.
I don't know if I've answered your question.
Thank you very much, Senator. And I think anything is possible, and politics is a terrific way to end today's session.
Thank you for having me here.
Thank you.
Thank you. Thank you.
And thank you very much. This is the end. This is the end of our forum, and we want to thank again the University of Nevada, Las Vegas for hosting us. And Rebels, there's always next year. Thanks.